Should you wait for the cataract to mature or ripen before you get operated? Hi, I'm Dr. Krishna Poojita. Today we're going to be talking about what has changed in cataract surgery from 40 years back to now. The cataract surgery began in 1700s and it has evolved to the time that we are having today. 30 to 40 years back, the cataract surgery involved an almost 10 to 11 millimeter cut which is made on the eye. The cataract was removed as it is and a hard or a rigid lens was put, which was a 6.5 millimeter lens that was put inside the eye through that 11 millimeter cut. Then this cut was closed using 5 stitches. So now at that point in time, because these 5 stitches and that big cut induced a lot of power or a need for spectacles inside the eye, the trend or the preference was to wait for the cataract to mature or ripen before getting operated. Next in technology was something called as a small incision cataract surgery, where the surgery incision site, the cut that was made on the eye was only about 6 millimeters. And that also involved putting a rigid or a hard lens inside. This surgery may or may not require a stitch on most occasions. From this small incision cataract surgery, the trend or the preference started moving towards intervention which is slightly earlier. Right now, what we operate is about 3.2 to 2.8 millimeter incision which is made on the eyeball. It is almost like an evolution of an abdominal surgery from an open surgery to a laparoscopic surgery. So something like that has happened in the eye where we do a 2.8 millimeter small incision through which a machine is inserted. We remove the cataract and we put a lens. Now how is this lens such a big lens that is put into the eye? The lens is rolled or folded into a cartridge. The small cartridge goes into the eye and the lens opens up like a flower inside the eye. So we are operating here through a very small cut. So the preference, the precision of the surgery is also much higher. You don't, most of the times, the kind of lens that we choose, we do not even require glasses after the surgery. So when we are operating and doing a high precision surgery and the size of incision is so small, the energy that is required to remove a hard cataract is much more than an early cataract removal. And hence, the trend or the preference now is to intervene much earlier than normal. So when is the best time to do a cataract surgery? Well, there is no clear answer to that question. Whenever you start feeling that you're having these glares, you're having disturbance in night vision, or you are having some trouble with focusing the distance, or your power is regularly changing, you can undergo cataract surgery even if it is not advanced. Thank you.